Welcome to our video on lung involvement. Systemic sclerosis can affect the lungs in several ways. You might notice shortness of breath, particularly, for example, going upstairs or up a hill, and you might get a dry, annoying cough. There are two ways in particular that the lungs can be involved. One is a condition called pulmonary fibrosis, scarring in the lungs. Again, rather annoyingly, it's also got another name called interstitial lung disease, or ILD. So we use those two terms interchangeably. So pulmonary fibrosis is a condition which causes, as I said, scarring in the lungs and can make people short of breath and have a dry cough. Occasionally, and much more rarely, patients can develop swelling in the ankles as well as shortness of breath. And that makes us think about a condition called pulmonary hypertension, which is high blood pressure on the right side of your heart, which causes back pressure and inability to clear fluids. So that's why you get the swelling in your ankles. So those are the two main aspects of lung involvement. So what do we do for checking for lung disease? Well, your doctor might ask you about your symptoms, as I've explained just now, and we would tend to order lung tests and heart tests every year in our patients. And that allows us to see a trend over time and whether there's a gradual decline in your lung function, giving us a hint that maybe there's something going on. The pulmonary function test is a test where you sit in a chamber and you blow into a tube, and that measures the volume of your lungs and how the gases interchange between the airways and the bloodstream. Then we might do lung imaging, or we usually do lung imaging. So we would do a chest x-ray and a CAT scan of your lungs, or a CT scan. We particularly do that if there's a concern for lung involvement. And the CAT scan gives us a much clearer idea of whether there is lung involvement. The chest x-ray is a good start, CAT scan is better. And then finally, I mentioned an echocardiogram, and that looks at how all the chambers of your heart are pumping and how well your heart is functioning, and whether there is this back pressure from the right side into your lungs. And there's just an image of lung function. What treatments can we use for interstitial lung disease, or ILD? It depends whether there's predominantly inflammation in your lungs or predominantly scarring in the lungs. If there's scarring, we use an anti-scarring agent. If there's inflammation, we use a whole variety of drugs that can suppress inflammation. So talk to your doctor about which one might be appropriate, or sometimes we use both. And that wraps up our lung involvement video.